Chapter 14, treatment of osteoporosis and Paget's disease of the bone. An estimated 10.2 million men and women in the US have osteoporosis. It is the most common disease of bones and affects women more often than men. It is a chronic progressive disease characterized by the loss of bone density and bone strength. It increases the risk for fractures. The risk for osteoporosis increases with age. 14.1 shows the normal bone on the left versus the osteoporotic bone on the right. You can see the difference in the, like where the little holes are. Primary osteoporosis is, of course, associated with the aging process. Up until the age of 30 or 40, the percentage of bone formed is greater than the percentage of bone lost. However, after menopause, women have a dramatic shift in the ratio between bone formation and bone loss, with bone loss exceeding bone formation. In men, this process is more gradual until the age of 65 or 70. And then the rates of women and men become more equal at that point. Bone formation is loss is a carefully controlled process and is regulated from birth to death. The process is called remodeling. Osteoblasts and osteoclasts are cells that are involved in the bone turnover process. Osteoblasts are responsible for bone formation, deposit, and mineralization of the collagen matrix of the bone. Osteoclasts are responsible for bone resorption, and bone resorption is the process whereby bone is broken down into mineral ions like calcium. If serum calcium levels are too low, hormones are released to transfer calcium stored in bones back into the serum. When blood calcium levels are too high, hormones are released to reduce serum calcium and deposit excess in bones. The hormones principally responsible for regulation of serum calcium levels are PTH, calcitonin, and vitamin D. PTH is secreted by the parathyroid gland when intestinal absorption of calcium and renal absorption of calcium are insufficient to maintain the required calcium balance. Some of the diseases that can produce secondary osteoporosis include hyperthyroidism, rheumatoid arthritis, inflammatory bowel disease, renal insufficiency, Parkinson's, multiple sclerosis, COPD, HIV, and AIDS. And again, listing all that stuff again, eating disorders, cystic fibrosis, polio, post-polio, organ transplants. So there's a lot of different things. Then we have drugs that can produce bone loss, anti-androgens, aromatase inhibitors, the medication cyclosporine, the medication medroxyprogesterone acetate, the depot injection, leuprolide, glucocorticosteroids, lithium methotrexate, anticonvulsants, and thiazolidinides. So table 14.1 shows how much calcium you need in your age. So if you're a woman between the ages of 18 through 50, you should be taking 1,000 milligrams of calcium each day, or that's how much you need, not that you need to be taking it exactly. Older than 50, women should take, women should get 1,200 milligrams a day. Men are actually 18 to 70 at 1,000 milligrams, and then 71 at 1,200. So table 14.2 lists the calcium in standard foods that we eat. Kind of interesting to see. Like all your dairy products, of course. Other stuff too, like mac and cheese and shrimp, canned shrimp though. Oranges, broccoli. Calcium can be obtained from calcium supplements in addition to food. They're available as calcium chloride, calcium citrate, and calcium carbonate, calcium lactate, and calcium gluconate. The amount of elemental calcium contained in these calcium salts varies. Calcium citrate is most absorbable and easy to tolerate. However, calcium carbonate provides the greatest amount of elemental calcium per tablet. Calcium carbonate should be taken on a full stomach. Food increases absorption and decreases upset stomach. Calcium citrate may be taken without regard to food. Calcium can inhibit reabsorption. Calcium can inhibit absorption of some medicines such as iron and levothyroxine. Warning labels should instruct patients to avoid calcium with 2 to 4 hours of any other medication taken by mouth. So this table just lists the calcium supplements available out on the market. There's all of these plus all the different generics, so the store brands, other brands that have formulated those vitamins. Paget's disease is a progressive disease of the bone. The cause is unknown, yet it is believed that genetics, viral infection, and environmental factors are a factor. It's most common in men older than 55. The disease produces excessive bone reabsorption followed by increased bone formation, resulting in enlarged bones that are structurally weak. Effects of the disease tend to be localized and most commonly affect the pelvis, lumbar, sacral spine, skull, femur, or tibia. However, it can be widespread throughout the body and the entire skeleton can be affected. It causes deformities such as bowed legs, pain, arthritis, deafness, and very rarely it causes cranial nerve palsies. Pain can be constant or intermittent, and it's typically associated with weight bearing or localized microfractures. The majority of the drugs used to treat osteoporosis and Paget's disease are anti-resorptive agents. They suppress bone turnover and loss. Bisphosphonates, calcitonin, and estrogens are anti-resorptive agents. Most of the biphosphonates are used for the treatment of Paget's disease and osteoporosis. The biphosphonates that are marketed in the United States when this book was made, which was I think in like 2018, alendronate, etadronate, ibandronate, pamidronate, risodronate, tyladronate, and zoledronic acid. So you can see all of those have the ending of dronate besides the last one. Biphosphonates inhibit bone resorption. Alendronate, ibandronate, and risodronate have been shown to reduce vertebral fractures by up to 40 to 50% and hip fractures by 20 to 50%. Ibandronate is approved by the U.S. Food and Drug Administration for Paget's disease. Intravenous zoledronic acid is indicated for hypercalcemia due to malignant tumors rather than osteoporosis and Paget's disease. There are 2 groups of biphosphonates, the nitrogen-containing biphosphonates, alendronate, pamidronate, and risodronate, are more potent than non-nitrogen-containing agents like etadronate or tyladronate. Pamidronate and zoledronic acid are administered by intravenous infusion. Biphosphonates are available in dosage forms for daily, alendronate, risodronate, and ibandronate, or weekly, alendronate, risodronate, monthly, risodronate, ibandronate, and then yearly zoledronic acid dosing. So what that means is they can either take a pill every single day to treat either osteoporosis or Paget's. They can take one on the same day every week instead of every day. They can take one monthly instead of daily or weekly. So obviously that depends on the doctor and the patient exclusively. But patient adherence, so patients taking their medication as prescribed, is definitely improved when the patient receives the medication dosed weekly or monthly. Zoledronic acid can be administered as a single dose annually for osteoporosis treatment or once every 2 years for prevention. It is also administered as a single dose to induce remission in Paget's disease. So if you're one of those people that can't take their medications on time, you can get an injection that will last for the whole year. To prevent injuries to the esophagus by biphosphonates, the patient should sit or stand upright for 30 to 60 minutes, depending on the agent after taking the medication. The medication should be taken with 6 to 8 ounces of water. Calcium and vitamin D supplementation is recommended in conjunction with biphosphonates, but should not be administered at the same time. Multivitamins with iron, calcium supplements, and antacids should be avoided within 2 hours of administration of the prescribed biphosphonate dose. So we have all our biphosphonates listed here. For alendronate, which is the generic for Benasto and Fosamax, that comes in a weekly tablet, daily tablet, and it comes in effervescent tablets. Aredia has only injections, no tablets. And then down here at the bottom, we have an alendronate and cholecalciferol combination, so Fosamax plus vitamin D. Selective estrogen receptor modulators, which we call SERMs, treat and prevent further destruction of bone architecture. They are indicated for treatment in postmenopausal women. Avista and Duavi are indicated for the treatment and prevention of osteoporosis. They reduce new fractures of the vertebrae over 3 years by 30 to 50%, but they have no effect on hip fractures. Only 2% of the amount of relofexine administered is bioavailable. First pass metabolism and protein binding limit the amount of drug absorbed to produce a therapeutic effect. Patients can be instructed to discontinue raloxifene at least 72 hours before and during prolonged immobilization, like bed rest after surgery, until fully ambulatory again to prevent VTE, venous thromboembolism. So we have Avista, and then we have the Duavi. Calcitonin is a hormone that is secreted by the thyroid gland and inhibits the rate of bone turnover stimulated by release of PTH. It lowers serum calcium levels by decreasing intestinal absorption of calcium and increasing renal elimination of calcium. These actions make calcitonin useful for the treatment of Paget's disease. So calcitonin comes in a nasal solution, which you'll see in both the retail and hospital world probably, and solution for injection you're going to see in the hospital world. Estrogen deficiency occurs with the onset of menopause and increases osteoclast activity. Osteoclasts are responsible for bone resorption. Hormone replacement restores estrogen levels and inhibits the effects of estrogen deficiency on bone. Estrogens with or without progestins are indicated for prevention of osteoporosis, decreasing bone turnover, bone loss, and fractures. Hormone replacement therapy is not a first line of therapy for the prevention of osteoporosis because of the increased risks for coronary heart disease, stroke, thromboembolism, as well as breast and uterine cancers. We have a chart here with hormone replacement therapies. Estradiol, there is a ton of different dosage forms and brand names. So we have patches that are biweekly that go by all of those names. A transdermal patch that is weekly, Clamera. There's tablets. There is a solution for injection. Clamera. PTH analogs increase the rate of bone remodeling, thicken structural units of the bone, and produce bone architecture that closely resembles normal bone. They decrease osteoblast cell death, allowing the balance between bone formation and bone resorption to shift toward bone formation. This is an important improvement over biphosphonates because alendronate, risindronate, and etidronate only prevent further destruction of bone architecture. They do not restore the normal structure. Teriparatide is a genetically engineered form of human PTH and the only drug currently available in this category. Because of the potential risk for osteosarcoma, the FDA requires a box warning stating that its use is limited for patients whom the benefits outweigh the risk. And that is Forteo, available only as a solution for injection. Denosumab is a monoclonal antibody that improves trabecular bone mass and strength. It produces its effects by inhibiting osteoclast activation and decreasing bone resorption. Bone remodeling is reversed from bone destruction to bone formation. It improves trabecular bone mass and strength. Denosumab is administered subcutaneously twice a year. Adverse reactions include increased risk for infections, hypocalcemia, skin rashes, osteonecrosis of the jaw, and fracture healing complications. So we have usual dosages and warnings used in the treatment of osteoporosis and Paget's disease. We already talked about this, but we're going to stand or sit upright for at least 30 minutes after taking. That's for alendronate, etodronate, and risodronate. Stand for or sit upright for 1 hour for ibandronate. Take 1 hour before the first meal of the day with ibandronate. And etodronate should be taken on an empty stomach, avoiding dairy products and calcium, magnesium, or iron within 2 hours of that dose. The serum Avista can be taken with or without food. And if you're using an estradiol patch, the site application should be rotated. Those should be taken with food. And of course, when it comes to our injectable Prolia, which is a newer, more expensive medication that is going to be refrigerated, should not be shooken at all, and it needs to be protected from light. Forteo needs to be refrigerated, cannot be freeze, and needs to be discarded after 28 days of opening.